Medical Assistant Exam OSHA and Safety Review. Question 1. When a patient encounter unfolds in an outpatient laboratory, a provider orders spirometry in the office. Which patient action is required? Option A. Remove the mouthpiece before starting. Option B. Hold both nostrils and refuse to exhale. Option C. Talk continuously during the maneuver. Option D. Follow instructions for a strong, complete breathing maneuver. The correct answer is option D. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The mouthpiece is needed to measure airflow. The test depends on controlled breathing through the device. Talking interferes with airflow measurement. Question 2. The care team in a women's health clinic asks for guidance because a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A. Keep the surface wet for the full listed contact time. Option B. Wipe the surface dry immediately. Option C. Use the disinfectant only on clean hands. Option D. Dilute the solution more to reduce odor. The correct answer is option A. Keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Question 3. At the start of care in a clinical skills review, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A. Gallbladder. Option B. Sinoatrial node. Option C. Alveolus. Option D. Ureter. The correct answer is option B. Sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. The gallbladder stores bile and is not cardiac conduction tissue. An alveolus is a lung air sac. A ureter carries urine from kidney to bladder. Question 4. At the start of care in a diagnostic testing area, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A. Use the oldest card in the file without asking. Option B. Code every visit as preventive care. Option C. Skip registration for returning patients forever. Option D. Verify insurance eligibility at each visit according to policy. The correct answer is option D. Verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Old cards may no longer reflect active coverage. Coding must reflect the service and documentation. Returning patients can have changed insurance or contact information. Question 5. During a same-day appointment, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Reverse isolation for staff protection only. Option B. Droplet precautions only. Option C. Airborne precautions. Option D. Contact precautions only. The correct answer is option C. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Droplet precautions do not address smaller airborne particles that can remain suspended. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Question 6. At the start of care in a family practice clinic, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A. Wait according to office protocol before measuring the oral temperature. Option B. Switch to a rectal temperature without asking. Option C. Record the temperature as normal without measuring it. Option D. Take the temperature immediately because oral readings are unaffected. The correct answer is option A. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Changing to an invasive route requires proper indication and protocol. Vital signs must be measured rather than assumed. Recent liquids can affect oral temperature results. Question 7. In a phlebotomy station, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Wrap the specimen in foil or use an amber container as directed. Option B. Place the tube in direct sunlight to warm it. Option C. Leave the specimen uncovered at the front desk. Option D, shake the specimen vigorously for 1 minute. The correct answer is option A. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Sunlight can degrade light-sensitive specimens. Delayed or improper handling can compromise results. Vigorous shaking can hemolyze blood specimens. Question 8. At the start of care in a women's health clinic, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, platelet. Option B, alveolus. Option C, ureter. Option D, axon. The correct answer is option D, axon. An axon carries nerve impulses away from the neuron cell body. A platelet is a blood component involved in clotting. An alveolus is a lung air sac. A ureter carries urine from kidney to bladder. Question 9. Before the visit continues in a patient intake station, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A, otoscope. Option B, ophthalmoscope. Option C, spirometer. Option D, speculum for pelvic exam. The correct answer is option A, otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. An ophthalmoscope is used to examine internal eye structures. A spirometer evaluates lung function rather than the ear. A vaginal speculum is not used to inspect the ear canal. Question 10. While working in a medical office workflow, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, use the instruments if the package is dry. Option B, write a new date on the package. Option C, open the package and rinse the instruments. Option D, reprocess the instruments before use. The correct answer is option D, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Changing the date without reprocessing is unsafe and misleading. Rinsing does not restore sterility. Question 11. An office review in a quality control review shows that the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A, perform hand hygiene. Option B, place the gloves in a regular drawer. Option C, apply lotion instead of cleaning hands. Option D, use the same gloves to clean the next room. The correct answer is option A, perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Used gloves are contaminated waste and should be discarded properly. Lotion does not replace hand hygiene. Gloves are task-specific and should not be reused between patients or areas. Question 12. To protect safety in an infection control audit, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A, notify the provider immediately and follow emergency protocol. Option B, complete all paperwork before telling anyone. Option C, tell the patient it is probably anxiety. Option D, ask the patient to drive to another clinic. The correct answer is option A, notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Administrative tasks should not delay reporting possible cardiac symptoms. Medical assistants should not diagnose the cause of chest pressure. Potential cardiac symptoms should be handled through established emergency procedures. Question 13. At the start of care in a same-day appointment, an electronic record uses an audit trail. What is its purpose? Option A, track who accessed or changed information. Option B, measure blood pressure. Option C, sterilize instruments automatically. Option D, approve insurance claims instantly. The correct answer is option A, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Payer claims processing is separate from record audit logs. Question 14. At the start of care in a family practice clinic, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, leave the old pharmacy because it is already in the chart. Option B, update the preferred pharmacy after verifying the new information. Option C, choose the pharmacy closest to the clinic. Option D, delete all pharmacy information from the record. The correct answer is option B. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. The preferred pharmacy should come from the patient rather than staff convenience. Removing needed information can interrupt prescribing workflows. Question 15. Given the workflow in a family practice clinic, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, schedule the patient for next month. Option B, give a diagnosis over the phone. Option C, tell the patient to send an email later. Option D, follow emergency triage protocol immediately. The correct answer is option D. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Potential emergencies require immediate action. Question 16. As part of exam preparation in a same-day appointment, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, SOAP. Option B, RACE. Option C, PRN. Option D, NPO. The correct answer is option B, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. SOAP is a documentation format and does not guide fire response. PRN means is needed and does not guide emergency fire response. NPO means nothing by mouth and is unrelated to fire safety. Question 17. Following office protocol in a clinical skills review, a sterile package is torn before a minor procedure. Which action is required? Option A, consider the contents contaminated and obtain a new sterile package. Option B, tape the wrapper and use the contents. Option C, use the items if they look clean. Option D, spray the package with disinfectant. The correct answer is option A. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Taping does not restore sterility after the barrier is compromised. Clean appearance does not prove sterility. Surface disinfectant cannot sterilize items inside a compromised package. Question 18. To protect safety in a procedure setup, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, discard the result because it is abnormal. Option B, notify the provider or designated clinical staff promptly. Option C, tell the patient the exact diagnosis without provider review. Option D, file the result for review at the end of the month. The correct answer is option B. Notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Diagnosis and interpretation belong to the provider. Delaying a critical result can put the patient at risk. Question 19. As part of exam preparation in a specialty referral visit, a specimen label is missing after collection. Which action is best? Option A, ask another patient if the tube belongs to them. Option B, send the tube with no label and explain later. Option C, follow facility policy for recollection or correction without guessing. Option D, write a name on the tube from memory. The correct answer is option C. Follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Patients cannot resolve specimen identity errors reliably. Laboratories commonly reject unlabeled specimens. Guessing can cause a serious misidentification error. Question 20. To protect safety in a certification exam scenario, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A, tilt the head far backward. Option B, sit upright and lean slightly forward. Option C, pack the nose with contaminated gauze. Option D, lie flat immediately without assessment. The correct answer is option B. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 21. For a patient encounter in a clinical skills review, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Follow manufacturer instructions and quality control policy. Option B. Skip controls because waived means unregulated. Option C. Report results before the test develops. Option D. Use expired kits if the package is unopened. The correct answer is option A. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Expired test kits may give unreliable results. Question 22. While working in a busy front office, a patient is placed lying face down for a back examination. Which position is being used? Option A. Lithotomy. Option B. Prone. Option C. Supine. Option D. Fowler. The correct answer is option B. Prone. Prone means lying on the abdomen with the face downward. Lithotomy involves legs in stirrups for certain pelvic procedures. Supine means lying on the back. Fowler is a seated or semi-seated position. Question 23. A medical assistant is working in an infection control audit when an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Recheck using proper technique and report the finding according to protocol. Option B. Send the patient home to rest without notifying anyone. Option C. Tell the patient that hypertension has been diagnosed. Option D. Erase the value because it may worry the patient. The correct answer is option A. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Medical assistants do not diagnose conditions based on one reading. Accurate documentation is required even when the value is abnormal. Question 24. After reviewing the situation in a walk-in clinic, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Wash the area and report the exposure according to protocol. Option B. Hide the incident if there is no bleeding. Option C. Place a bandage on the site and ignore it. Option D. Finish all remaining patients before telling anyone. The correct answer is option A. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Covering the wound alone does not address exposure risk. Delaying reporting can delay needed evaluation and follow-up. Question 25. The care team in a procedure setup asks for guidance because a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A. Routine scheduling. Option B. Appropriate marketing. Option C. Breach of confidentiality. Option D. Quality control testing. The correct answer is option C. Breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Scheduling does not involve posting private health information publicly. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Quality control relates to test system accuracy, not social media disclosure. Question 26. Given the workflow in a patient intake station, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Ignore the band if the patient seems healthy. Option B. Verify the allergy information in the record and with the patient. Option C. Give medication first and ask about allergies later. Option D. Remove the band so it does not worry the patient. The correct answer is option B. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Allergy risk is not based on appearance. Allergies must be checked before administration. Removing an alert without direction can create risk. Question 27. The care team in an urgent care office asks for guidance because a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, administer the medication because it was ordered. Option B, hold the medication and notify the provider. Option C, change the medication to another drug independently. Option D, ask the patient to sign a form and give it anyway. The correct answer is option B, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. Medical assistants do not independently substitute medications. A form does not make an unsafe medication appropriate. Question 28. Before the visit continues in a medical office workflow, a patient feels faint during a blood draw. Which response should occur first? Option A, finish filling the tube before responding. Option B, tell the patient to stand up quickly. Option C, leave the patient alone to find paperwork. Option D, stop the procedure and protect the patient from injury. The correct answer is option D, stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. Continuing the draw can worsen the situation and increase injury risk. Standing can worsen faintness and lead to a fall. A faint patient should not be left unattended. Question 29. To protect safety in a family practice clinic, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A, assault. Option B, coinsurance. Option C, abandonment. Option D, beneficence. The correct answer is option C, abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Coinsurance is a payment-sharing insurance term. Beneficence means acting for the patient's good. Question 30. Following office protocol in an exam room, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, refuse because records belong only to the provider. Option B, delete sensitive information before the request is reviewed. Option C, give the record to anyone who asks. Option D, follow the office release of information process. The correct answer is option D, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Patients have rights to access their health information under applicable rules. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Question 31. A medical assistant is working in a phlebotomy station when a patient falls in the exam room. Which action is best? Option A, hide the incident if no one saw it. Option B, pull the patient up immediately. Option C, call for help and assess for injury before moving the patient. Option D, tell the patient to drive home without evaluation. The correct answer is option C, call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. The patient should be assessed before leaving. Question 32. To protect safety in a patient education session, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A, follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option B, ignore all provider instructions about inhalers. Option C, eat a heavy meal immediately before every test. Option D, wear tight clothing that restricts breathing. The correct answer is option A, follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Medication instructions should follow the provider or testing protocol. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Question 33. As part of exam preparation in a busy front office, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A, maintain required temperature storage and check expiration before use. Option B, place it in direct sunlight to warm quickly. Option C, use it after expiration if it looks clear. Option D, store it in a desk drawer overnight. The correct answer is option A, Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Sunlight and heat can damage the product. Appearance does not prove potency after expiration. Room temperature storage can damage refrigerated products. Question 34. As part of exam preparation in an outpatient laboratory, blood spills on an exam room floor. Which response follows standard safety practice? Option A. Cover the spill with an exam table paper. Option B. Use appropriate personal protective equipment and an approved disinfectant. Option C. Ask a patient to avoid stepping on it. Option D. Wipe the spill with a dry paper towel only. The correct answer is option B. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Covering a spill does not remove or disinfect the hazard. Patients should not be involved in hazardous cleanup. Dry wiping can spread contamination and does not disinfect the surface. Question 35. Before the visit continues in an outpatient laboratory, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Skip technique instructions because home cuffs are automatic. Option B. Write only the highest number ever measured. Option C. Record readings with date, time, and relevant notes as directed. Option D. Use another person's readings if the cuff is shared. The correct answer is option C. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Proper positioning and technique still matter with automatic cuffs. Selective recording can mislead clinical decisions. Readings must belong to the patient. Question 36. When a patient encounter unfolds in an urgent care office, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Post the reminder on social media. Option B. Follow office policy and patient communication preferences. Option C. Ignore all reminder preferences. Option D. Text any diagnosis to any phone number in the chart. The correct answer is option B. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Public posting would expose private information. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Question 37. As part of exam preparation in a pediatric clinic, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Record the respiratory rate from the last visit. Option B. Count for 5 seconds and multiply by 12. Option C. Ask the patient to breathe as deeply as possible. Option D. Count respirations while the patient is unaware of the measurement. The correct answer is option D. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Current respirations must be measured during the encounter. Very short counts are often inaccurate for respirations. Deep breathing changes the normal respiratory rate and effort. Question 38. After reviewing the situation in a quality control review, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Pull the patient by the arms quickly. Option B. Lock the wheelchair and use proper body mechanics with assistance as needed. Option C. Leave the wheelchair unlocked for easier movement. Option D. Ask the patient to jump to the table. The correct answer is option B. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Pulling can injure the patient and the assistant. An unlocked wheelchair can roll and cause a fall. Jumping is unsafe and unrealistic for a transfer. Question 39. To protect safety in a clinical skills review, the term nephrology appears in a referral. Which specialty is involved? Option A. Bones. Option B. Eyes. Option C. Kidneys. Option D. Ears. The correct answer is option C. Kidneys. Nephrology is the specialty focused on kidney function and disease. Orthopedics focuses on the musculoskeletal system. Ophthalmology focuses on eyes. Otolaryngology focuses on ear, nose, and throat conditions. Question 40. Before the visit continues in an infection control audit, a complete blood count is ordered. Which tube is most commonly used? Option A, gray tube with fluoride oxalate. Option B, lavender tube with EDTA. Option C, light blue tube with sodium citrate. Option D, a red tube with no anticoagulant. The correct answer is option B, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Gray tubes are used for tests such as glucose or lactate depending on protocol. Sodium citrate is used mainly for coagulation studies. A red tube allows clotting and is not the standard choice for a complete blood count. Question 41. At the start of care in a community health clinic, a tickler file is used in the office. Which purpose does it serve? Option A, track future follow-ups or reminders. Option B, sterilize instruments. Option C, measure oxygen saturation. Option D, draw blood into tubes. The correct answer is option A, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Oxygen saturation requires a pulse oximeter. Blood collection uses phlebotomy supplies, not a reminder file. Question 42. Before the visit continues in a patient education session, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, use the first visibly dirty drop for every test. Option B, skip patient identification because the test is quick. Option C, clean and dry the puncture site according to protocol. Option D, puncture through visible dirt. The correct answer is option C, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Site contaminants can affect the first drop depending on protocol. Patient identification is required even for quick point-of-care tests. Contamination can affect the sample and infection risk. Question 43. While working in a telephone triage workflow, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, use a qualified medical interpreter. Option B, skip the explanation if the patient nods. Option C, ask a young child to interpret. Option D, speak louder and slower in English only. The correct answer is option A, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Nodding does not prove understanding or valid communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Volume does not remove a language barrier. Question 44. An office review in an urgent care office shows that the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A, before. Option B, below normal or deficient. Option C, against. Option D, above normal. The correct answer is option B, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Before is indicated by pre. Against is indicated by anti. Above normal is indicated by hyper. Question 45. At the start of care in a cardiology practice, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the left sternal border. Option B, fourth intercostal space at the right sternal border. Option C, left arm below the clavicle. Option D, fifth intercostal space at the left midclavicular line. The correct answer is option B, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V2. The left arm electrode is a limb lead site, not V1. That location corresponds to V4 in standard placement. Question 46. After reviewing the situation in a walk-in clinic, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, thyroxine. Option B, melatonin. Option C, estrogen. Option D, insulin. The correct answer is option D, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Thyroxine is a thyroid hormone involved in metabolism. Melatonin is associated with sleep-wake cycles. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Question 47. In a specialty referral visit, a used needle must be discarded after an injection. Which practice is safest? Option A. Carry the needle to the front desk for disposal. Option B. Recap the needle with both hands. Option C. Place the needle in regular trash. Option D. Activate the safety device and place the needle in a sharps container. The correct answer is option D. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Question 48. Before the visit continues in a certification exam scenario, a rapid strep test requires a throat swab. Which technique is best? Option A. Touch the tongue repeatedly to collect saliva. Option B. Swab the tonsillar area and posterior pharynx while avoiding the tongue. Option C. Swab the outside of the lips. Option D. Collect sputum from a deep cough. The correct answer is option B. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Saliva and tongue contact can dilute or contaminate the specimen. The lips do not provide the specimen needed for strep testing. Sputum is not the specimen used for a rapid strep throat swab. Question 49. Given the workflow in a family practice clinic, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A. Ventricular filling with blood only. Option B. Ventricular depolarization. Option C. Atrial repolarization only as the visible main event. Option D. A lung gas exchange. The correct answer is option B. Ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Mechanical filling is not the primary electrical event represented by QRS. Atrial repolarization is usually hidden within the QRS complex. Gas exchange occurs in the alveoli, not on the QRS waveform. Question 50. During a community health clinic, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Ignore it because it is not in an exam room. Option B. Wait until a patient reports slipping. Option C. Cover it with loose papers. Option D. Place a warning sign and arrange cleanup immediately. The correct answer is option D. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Safety hazards matter throughout the facility. Prevention should occur before an injury happens. Loose paper can worsen slipping and does not clean the hazard. Question 51. Following office protocol in a telephone triage workflow, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A. Specimen collected from the toilet bowl. Option B. First drops of urine into an unclean container. Option C. Clean catch midstream specimen. Option D. A random sample from an old urinal. The correct answer is option C. Clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Toilet water contaminates the specimen. Initial urine can carry contaminants and an unclean container is inappropriate. Old specimens may be contaminated and may not reflect current results. Question 52. As part of exam preparation in a certification exam scenario, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Fast breathing. Option B. Inflammation of the liver. Option C. High blood sugar. Option D. Slow heart rate. The correct answer is option D. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Fast breathing is tachypnea rather than bradycardia. Inflammation of the liver is hepatitis. High blood sugar is hyperglycemia. Question 53. As part of exam preparation in a clinical skills review, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Give oral medication before checking responsiveness. Option B. Wait for the provider before starting any response. Option C. Use the defibrillator on a conscious patient asking questions. Option D. Begin CPR and use the automated external defibrillator as directed. The correct answer is option D. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Oral medication is unsafe when cardiac arrest is suspected. Delaying basic life support can reduce survival. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Question 54. After reviewing the situation in an internal medicine office, a pelvic examination is scheduled. Which patient position is commonly used? Option A, Sims. Option B, Trendelenburg. Option C, lithotomy. Option D, a prone. The correct answer is option C, lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position. Question 55. The care team in an administrative check-in area asks for guidance because muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A, place the paper speed at 0. Option B, remove all electrodes during the recording. Option C, ask the patient to tense all muscles. Option D, help the patient relax and support the limbs. The correct answer is option D, help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Paper movement is needed to record the waveform. Electrodes are required to capture the tracing. Tensing muscles increases electrical artifact. Question 56. While working in a diagnostic testing area, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, ear inflammation. Option B, difficulty swallowing. Option C, excessive thirst. Option D, painful or difficult urination. The correct answer is option D, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Ear inflammation is otitis. Difficulty swallowing is dysphagia. Excessive thirst is polydipsia. Question 57. Before the visit continues in a diagnostic testing area, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, 5th intercostal space at the left midclavicular line. Option B, midway between V2 and V4. Option C, a 4th intercostal space at the right sternal border. Option D, a 4th intercostal space at the left sternal border. The correct answer is option A, 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V3 rather than V4. That location is used for V1. That location is used for V2. Question 58. Before the visit continues in a procedure setup, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, coinsurance. Option B, referral. Option C, remittance address. Option D, copayment. The correct answer is option A, coinsurance. Coinsurance is the patient's percentage share of covered costs. A referral is permission or direction to see another provider. A remittance address tells where payments or documents are sent. A copayment is usually a fixed amount rather than a percentage. Question 59. Given the workflow in a family practice clinic, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, appointment reminder template. Option B, safety data sheet. Option C, insurance remittance advice. Option D, patient intake form. The correct answer is option B, safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Reminder templates do not address workplace chemical safety. Remittance advice explains payment decisions, not chemical hazards. An intake form does not provide chemical safety instructions. Question 60. Before the visit continues in an electronic health record review, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A, suggest using a friend's medication. Option B, tell the patient to stop immediately. Option C, refer the question to the provider. Option D, recommend doubling the dose instead. The correct answer is option C, refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Sharing medication is unsafe and inappropriate. Directing medication discontinuation is outside the assistant role. Changing a dose without provider order is unsafe and outside scope. Question 61. When a patient encounter unfolds in a cardiology practice, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Assume all people from that culture act the same. Option B. Ask respectful questions and avoid judgment. Option C. Tell the patient the practice is foolish. Option D. Refuse to document relevant information. The correct answer is option B. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Stereotyping ignores individual differences. Judgmental language damages trust and may prevent disclosure. Relevant patient information should be documented according to policy. Question 62. At the start of care in a treatment room, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A. Wave scheduling. Option B. Double booking. Option C. Open hours. Option D. Clustering. The correct answer is option B. Double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Question 63. When a patient encounter unfolds in a cardiology practice, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Assist the patient to sit or lie down safely. Option B. Ask the patient to walk faster. Option C. Tell the patient dizziness is impossible. Option D. Leave the patient standing while searching for forms. The correct answer is option A. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Walking can increase fall risk when the patient is dizzy. Dismissing symptoms does not protect patient safety. An unsteady patient should not be left unsupported. Question 64. Before the visit continues in a treatment room, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A. Protein in the stool. Option B. Sugar in the blood. Option C. Blood in the urine. Option D. Air in the lungs. The correct answer is option C. Blood in the urine. Hematuria means blood is present in the urine. Protein in stool is not hematuria. Sugar in the blood is described by glycemia terms. Air in the lungs is not described by hematuria. Question 65. To protect safety in a certification exam scenario, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A. Light blue sodium citrate tube. Option B. Gray fluoride oxalate tube. Option C. Lavender EDTA tube. Option D. Green heparin tube. The correct answer is option A. Light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. Gray tubes are generally collected near the end of the order. EDTA tubes are collected later because the additive can contaminate other tubes. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. Question 66. A medical assistant is working in a specialty referral visit when a subpoena for medical records arrives at the office. Which response is best? Option A. Ignore it because subpoenas never apply to clinics. Option B. Immediately fax the entire chart without review. Option C. Give it to the provider or designated privacy officer for proper handling. Option D. Ask the receptionist to summarize the chart from memory. The correct answer is option C. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Subpoenas can require action and should not be ignored. Records should not be released without verifying legal requirements and scope. Summaries from memory are unreliable and not an appropriate legal response. Question 67. In an administrative check-in area, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Apply droplet precautions and offer a mask according to protocol. Option B. place the patient beside an immunocompromised patient. Option C, skip precautions if the patient is already taking medication. Option D, use only sterile gloves without a mask. The correct answer is option A. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Separating symptomatic patients helps reduce transmission risk. Treatment does not remove the need for appropriate precautions. Sterile gloves do not protect mucous membranes from respiratory droplets. Question 68. A medical assistant is working in a walk-in clinic when the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A, organic material can interfere with sterilization. Option B, sterilization is the same as hand washing. Option C, disinfection always destroys every spore. Option D, packaging instruments makes cleaning unnecessary. The correct answer is option A. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Hand washing reduces microbes on skin but is not instrument sterilization. Disinfection reduces many organisms but does not reliably destroy all spores. Packaging dirty instruments traps contamination rather than preparing them safely. Question 69. During an outpatient laboratory, a capillary puncture is needed on an adult finger. Which site is generally preferred? Option A, the center of the thumb pad. Option B, the tip of the index finger. Option C, the little finger near the bone. Option D, the side of the middle or ring finger pad. The correct answer is option D, the side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The thumb is often calloused and has a pulse, making it less preferred. The index finger is commonly used for touch and may be more sensitive or calloused. The little finger has less tissue over bone and is usually avoided. Question 70. A medical assistant is working in a telephone triage workflow when a multi-dose vial has no date after being opened. Which action is most appropriate? Option A, guess the opening date from memory. Option B, mix it with another vial to avoid waste. Option C, follow facility policy and do not use it if safety cannot be verified. Option D, use it because the cap is still attached. The correct answer is option C. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. The cap does not prove when the vial was opened or whether it was stored correctly. Question 71. Following office protocol in a procedure setup, a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A, give a diagnosis to save time. Option B, ignore the symptoms because they are subjective. Option C, tell the patient to search the internet for a diagnosis. Option D, document the symptoms and tell the patient the provider will evaluate them. The correct answer is option D, document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Diagnosing is outside the medical assistant scope. Reported symptoms are relevant and should be documented. Unguided self-diagnosis can be inaccurate and unsafe. Question 72. In a procedure setup, a claim requires the code for an office visit procedure or service. Which code set is used? Option A, CPT. Option B, ICD-10-CM. Option C, zip code. Option D, policy number. The correct answer is option A, CPT. CPT codes describe medical procedures and professional services. ICD-10-CM codes describe diagnoses and reasons for services. A zip code identifies location and is not a procedure code. A policy number identifies insurance coverage and does not describe the service. Question 73. While working in a pediatric clinic, a reagent bottle is past its expiration date. Which action is appropriate? Option A, use it only for abnormal patients. Option B, change the expiration date on the label. Option C, mix it with a new reagent to strengthen it. Option D, do not use it for patient testing. The correct answer is option D, do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Expired reagents are not reliable for any patient testing. Altering dates is unsafe and unethical. Mixing reagents without approval can invalidate testing. Question 74. For a patient encounter in a patient education session, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Perform blind finger sweeps immediately. Option B. Give the patient food to push it down. Option C. Encourage coughing and monitor closely. Option D. Leave the patient alone until they stop coughing. The correct answer is option C. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. Food can worsen the obstruction. The patient should be monitored because the obstruction may worsen. Question 75. Given the workflow in an outpatient laboratory, an insurance plan requires approval before a specialist visit. Which process is being described? Option A. Prior authorization or referral process. Option B. Venipuncture. Option C. Autoclaving. Option D. Auscultation. The correct answer is option A. Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Venipuncture is blood collection and does not authorize insurance coverage. Autoclaving sterilizes instruments and is unrelated to payer approval. Auscultation is listening to body sounds and does not approve visits. Question 76. Before the visit continues in a family practice clinic, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Gently invert the tube the required number of times. Option B. Shake the tube forcefully. Option C. Open the tube and stir with a swab. Option D. Leave the tube unmixed until pickup. The correct answer is option A. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Question 77. To protect safety in a preventive care visit, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A. Tell the patient to drive home and rest. Option B. Notify the provider and activate emergency protocol immediately. Option C. Schedule a routine follow-up for next week. Option D. Ignore the symptoms if the injection site looks clean. The correct answer is option B. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Respiratory symptoms and swelling require immediate attention. Potential anaphylaxis cannot be delayed for routine follow-up. Systemic allergic symptoms matter even if the injection site appears normal. Question 78. An office review in a telephone triage workflow shows that a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A. Battery. Option B. Defamation. Option C. Emancipation. Option D. Coordination of benefits. The correct answer is option A. Battery. Battery can involve intentional touching or treatment without consent. Defamation involves false statements that harm reputation. Emancipation relates to a minor's legal independence. Coordination of benefits is an insurance concept. Question 79. Before the visit continues in a cardiology practice, a centrifuge is used in the laboratory. Which safety practice is important? Option A. Open the lid while it is spinning. Option B. Balance tubes before starting the centrifuge. Option C. Stop the rotor with a hand. Option D. Place only one tube at any weight in the rotor. The correct answer is option B. Balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Opening a spinning centrifuge is unsafe. Stopping a rotor manually is dangerous. Unbalanced loads can damage the machine or specimens. Question 80. For a patient encounter in a primary care office, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A. Offer water by mouth immediately. Option B. Activate emergency response and assess breathing according to training. Option C. Finish documenting the previous visit. Option D. Move the patient to a chair before assessing. The correct answer is option B. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Question 81. An office review in a walk-in clinic shows that a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Delete the original note completely. Option B. Ask a coworker to change it under their login. Option C. Make an addendum according to office policy. Option D. Ignore the error even if it affects care. The correct answer is option C. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Deleting a signed record can destroy the audit trail. Using another person's login violates accountability. Clinically important errors should be corrected through proper procedures. Question 82. As part of exam preparation in a specialty referral visit, a waived glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Record patient results without documenting controls. Option B. Resolve the quality control problem according to protocol. Option C. Change the patient's diagnosis to match the meter. Option D. Use the meter because patient samples are different. The correct answer is option B. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Failed controls must be addressed before reporting patient values. Question 83. An office review in an electronic health record review shows that a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Using sterile forceps for sterile supplies. Option B. Keeping sterile items above waist level. Option C. Reaching across the sterile field with an unsterile sleeve. Option D. Opening the wrapper away from the body first. The correct answer is option C. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Question 84. During a pediatric clinic, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A. Ignore the waveform and record the lowest value. Option B. Place the probe over wet nail polish. Option C. Warm the finger or choose a better perfused site. Option D. Increase oxygen without reporting the finding. The correct answer is option C. Warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. An unstable signal should be corrected before documenting the value. Moisture and polish can interfere with sensor performance. Medication or oxygen changes should follow provider direction and clinical protocol. Question 85. Before the visit continues in a patient education session, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Ignore the medication order completely without communication. Option B. Interpret the abbreviation however it seems most likely. Option C. Ask another patient what the abbreviation means. Option D. Clarify the order before proceeding. The correct answer is option D. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. Question 86. Before the visit continues in an outpatient laboratory, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It is used only to schedule appointments. Option B. It replaces all insurance forms. Option C. It allows the assistant to ignore provider orders. Option D. It communicates the patient's wishes about future medical care. The correct answer is option D. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Scheduling is unrelated to the purpose of an advance directive. Advance directives do not replace billing or insurance documents. Care decisions still follow legal, clinical, and facility processes. Question 87. An office review in a certification exam scenario shows that a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, tell the patient to bring personal gloves only. Option B, ignore the allergy if the procedure is short. Option C, use latex-free supplies and clearly communicate the allergy. Option D, use powdered latex gloves because they are easier to put on. The correct answer is option C. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. Question 88. A medical assistant is working in a treatment room when a patient becomes angry about a long wait time. Which response is most appropriate? Option A, tell the patient to calm down or leave. Option B, blame the provider in front of the patient. Option C, ignore the patient until the appointment starts. Option D, acknowledge the frustration and provide a realistic update. The correct answer is option D, acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Commands can escalate conflict and harm patient rapport. Blaming coworkers is unprofessional and does not solve the issue. Ignoring frustration often makes the situation worse. Question 89. For a patient encounter in a patient intake station, the term hypertension appears in the problem list. Which meaning is correct? Option A, slow breathing. Option B, low blood glucose. Option C, high blood pressure. Option D, joint inflammation. The correct answer is option C, high blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Slow breathing is bradypnea. Low blood glucose is hypoglycemia. Joint inflammation is arthritis. Question 90. During a medical office workflow, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A, peak flow meter only. Option B, tuning fork only. Option C, ophthalmoscope only. Option D, suture removal scissors or sterile scissors according to policy. The correct answer is option D, suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. A peak flow meter measures expiratory airflow and does not remove sutures. A tuning fork may be used in hearing or vibration tests. An ophthalmoscope is used to examine the eye, not remove sutures. Question 91. After reviewing the situation in a clinical skills review, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A, a promise that medication will be prescribed. Option B, the assistant's guess about the diagnosis. Option C, only the caller's first name. Option D, caller identity, contact information, reason for call, and urgency. The correct answer is option D, caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. Medication decisions belong to the provider. Diagnosis should not be guessed in a phone message. A first name alone may not identify the patient or issue. Question 92. In a telephone triage workflow, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, include unrelated patient charts in the same fax. Option B, leave the fax confirmation on a public counter. Option C, send it to a number from memory without checking. Option D, verify the recipient fax number before sending. The correct answer is option D, verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Only necessary information should be disclosed. Confirmation pages may contain protected information and should be handled securely. Memory errors can lead to misdirected protected information. Question 93. During a cardiology practice, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A, hand washing is needed only before eating. Option B, alcohol sanitizer is always illegal in clinics. Option C, soap and water help remove spores more effectively from the hands. Option D, gloves completely replace hand hygiene. The correct answer is option C. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Hand hygiene is required at multiple points in patient care. Alcohol-based hand rubs are appropriate for many routine situations. Gloves reduce exposure but do not replace hand hygiene after removal. Question 94. As part of exam preparation in a patient education session, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A, Snellen chart. Option B, hemostat. Option C, tourniquet. Option D, autoclave tape. The correct answer is option A, Snellen chart. A Snellen chart is used to screen distance visual acuity. A hemostat clamps tissue or small objects during procedures. A tourniquet helps locate veins for blood collection. Autoclave tape indicates exposure to sterilization conditions. Question 95. For a patient encounter in a walk-in clinic, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, HIPAA. Option B, PERLA. Option C, PASS. Option D, ARICE. The correct answer is option C, PASS. PASS stands for pull, aim, squeeze, and sweep. HIPAA governs health information privacy and security. PERLA describes pupil assessment. RICE refers to rest, ice, compression, and elevation for certain injuries. Question 96. A medical assistant is working in a specialty referral visit when a mask becomes wet during patient care. Which action is appropriate? Option A, share it with a coworker. Option B, replace the mask according to infection control practice. Option C, keep wearing it for the rest of the week. Option D, dry it on the clean supply shelf. The correct answer is option B, replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Masks are not shared between staff. Extended use of a wet mask is not appropriate. Used masks can contaminate clean areas. Question 97. Following office protocol in a certification exam scenario, an intradermal test is being prepared. Which description matches the route? Option A, medication swallowed by mouth. Option B, medication placed into the ear canal. Option C, injection just under the epidermis to form a small wheal. Option D, injection into deep muscle tissue. The correct answer is option C, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Swallowed medication is oral administration. Ear canal administration is otic. Deep muscle injection is intramuscular. Question 98. To protect safety in a patient intake station, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, discard the first void and collect all urine for the next 24 hours. Option B, keep only the first void and discard the rest. Option C, leave the container unrefrigerated unless it smells unusual. Option D, collect urine only when symptoms occur. The correct answer is option A, discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. A single first void is not a 24-hour collection. Storage requirements should follow the test protocol and preservative instructions. Timed urine testing requires all urine during the collection period. Question 99. Given the workflow in an exam room, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A, ask another patient in the waiting room to consent. Option B, follow state law and office policy for consent requirements. Option C, refuse all care without considering exceptions. Option D, assume all minors can consent to every service. The correct answer is option B, follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Other patients cannot provide consent for the minor. Some laws allow minors to consent for certain services. Minor consent is not universal for all services. Question 100. To protect safety in a telephone triage workflow, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, Trendelenburg as the only routine choice. Option B, Fowler position. Option C, prone position. Option D, lithotomy position. The correct answer is option B, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Prone places the patient face down and may worsen breathing comfort. Lithotomy is used for pelvic procedures and does not primarily support breathing.